Antenatal part, what we have seen, that the after conceiving and till now up to the pregnancy, that is called the antenatal period. And antenatal period also the 3 times chart. What is that? Anyone can say? What is the 3 times chart during the antenatal period? First, second and the third time chart. What is the first time chart? That is the after conceiving to the 12 to 14 weeks. And next is the 14 to 28 weeks. And after that 28 to up to the delivery, that is the third time chart during the pregnancy. So now we will see the normal puerperium. What is the normal puerperium? After delivery of the childbirth, that time period up to the 42 weeks, that we used to tell that the puerperium period বা postnatal period. So in this class, whatever we will see, that is the definition of the puerperium, then the time period during the postnatal period and the puerperium period. Total time limit in the puerperium, that is the 42 weeks. Next হচ্ছে anatomical changes. In the antenatal also we have seen that the physiological changes occurring during the antenatal period. So same thing will happen in the postnatal. Physiological changes, lactation, nursing management, management of the minor alignments, recording and the checkup and advice during the discharge. So introduction, postpartum period is the period beginning immediately after the birth of a child and extending for about the 6 weeks. 6 weeks means that is the 42 days. So after delivery, after childbirth, up to the 42 days or 6 weeks, that time period is called the puerperium. Okay? The WHO describes the postnatal period as the most critical and yet most neglected phase in the lives of the mothers and the babies. Most death occurs during the postnatal period. In the antenatal period, only mother was there. During the postnatal, mother and also baby is coming. So both are the vulnerable group. Okay, child and also the mother. So during that time period, more mortality is happening during the postnatal period. Next. What is the definition of the puerperium? What is the definition? Puerperium is the period following the childbirth during which the body tissue, especially the pelvic organs, reverts back approximately to the pre-pregnant state, both anatomically and the physiologically. During the antenatal period, some physiological changes happen. Na? What is that? Is the uterus, then respiratory system, cardiovascular system, then genitourinary tract system, every system has changed during the antenatal period. In the postnatal period, what will be the happen? Whatever changes occur in the antenatal period, that will revert back into the pre-pregnant state. Okay, বোঝা যাচ্ছে? So involution, what is the involution? Involution is the process where the genital organs revert back approximately to the state as they were before the pre-pregnancy. তাহলে ইজিলি মনে রাখতে হবে যে অ্যান্টিনেটালে আমাদের প্রেগন্যান্সি যে চেঞ্জেস গুলো হয়েছিল আফটার চাইল্ড বার্থ পোস্টনেটাল পিরিয়ডে সেগুলো আবার রিভার্ট ব্যাক করবে লাইক দ্য নন প্রেগন্যান্ট স্টেটে। বোঝা গেছে? And the woman is termed as the puerpera. The time period after childbirth is called the puerperium and the woman is called the puerpera. Okay? Duration. Puerperium begins as soon as the placenta expels and the lasts for the approximately the 6 weeks when the maternal system returns to the pre-pregnant state. So, in the postnatal period, what I have told that the 42 days or the 6 weeks. In between the 6 weeks after following the delivery, we can divide also. So, what is that? Immediate within the 24 hours, early up to the 7 days and remote up to 6 weeks. Okay? So, 6 weeks we can divide immediate, early and the remote. Understood everyone? Any query? So now we'll go to the anatomical changes during the puerperium. Involution of the uterus. At first, during the puerperium, what happened? Uterus involution will happen. Immediately following delivery, the uterus becomes the firm, retract with the alternate hardening and the softening. The uterus measures about the 20 into 12 into 7.5 centimeter respectively length, breadth and the thickness. And at the end of the 6 weeks, its measurement is almost similar to that the non-pregnant state. Okay. So during the pregnancy, how much weight gain happen in the uterus? In the non-pregnant state, what is the actual weight of uterus? 50 to 60 gram. And the pregnancy period, that will increase the 1000 gram. So after childbirth, again the uterus will come back 50 to 60 gram. Understood? The placental site contracts rapidly, presenting a raised surface with the measures about 7.5 centimeter and remains elevated at the 6 weeks when it measures about the 1.5 centimeter. So cervix, what happened in the cervix? The cervix contracts slowly. The external os admits the 2 fingers for a few days, but the end of the first weeks narrows down to admit the tip of a finger only. The contour of the cervix takes place a longer time to remain and the external os never revert back to the nulliparous state. It will revert back like as the non-pregnant woman, but never will revert back the nulliparous state. Okay. So next, the muscle. What happened? The uterine muscle. There is a marked hypertrophy and the hyperplasia of the muscle during the pregnancy, and the individual muscle fiber enlarges to the extent of 10 minutes in the leg and 5 times in the breast. Autolysis happen. So if autolysis happen, then the muscle constrict. These are the excreted through the kidneys as urea and the creatinine. This explains the increased excretion the products in the puerperal urine. And the connective tissue also undergo the same type of the degeneration. Mainly the autolysis happen in the muscle fibers.